Painful arc syndrome or shoulder impingement syndrome is a clinical syndrome in which there is a pain in the shoulder and upper arm during the mid-range of shoulder abduction. Following are the common causes for painful arc syndrome: minor tears of supraspinatus tendon, supraspinatus tendinitis, calcification of supraspinatus tendon, subacromial bursitis, fracture of the greater tuberosity. In all these conditions, the space between upper end of humerus and the acromion process get compressed. So, during mid-abduction, the tendon of the rotator cuff compressed between the greater tuberosity and acromion process. So, the pain occurs when there is a mid-range of abduction. To diagnose the painful arc syndrome or shoulder impingement syndrome, the X-ray is done. X-ray mainly shows calcific deposit or greater tuberosity fracture if there is a painful arc syndrome. Your physiotherapist may perform shoulder painful arc test to diagnose painful arc syndrome. Patient may have severe pain in mid-range abduction, so it can indicate that the patient may have painful arc syndrome. The treatment plan for the painful arc syndrome include anti-inflammatory drugs, hydrocortisone injections in the subacromial space, excision of the prominent part of the acromion, and ultrasound therapy to the tender point.